Hello, and welcome to your cranial nerve exam. How are you doing today? Okay, that's okay. We will get to the bottom of it today, okay? Now I understand you're on a bit of a time crunch today, so it will be a full cranial nerve with all 5 nerves being tested. Okay, perfect. Yeah, we can absolutely do that. That's no problem whatsoever. So I think, do you have any issues with your breathing lately or anything like that? No? Okay. So then you're probably good to skip the little stethoscope test. Okay, yeah, absolutely. Let's just dive right in to those 5 cranial nerve sections, okay? So the first one we are going to start with is sound, okay? So I'd just like you to hear this little sound of this comb. You can hear that? Okay. So what I'm going to be doing is on each side of your head, in each ear, I'm going to be making this comb sound, okay? And I just want you to tell me when that sound completely stops, okay? When you hear it go completely dead silent, let me know, okay? Perfect. Okay, well, let's start just on this side here. Very good. Okay, and just on this side now. Very good, okay, and then just one more on this time, except we are going to be using the other side now, okay? It makes a slightly different sound, okay? This will allow us to see where the decibels of sound go with your hearing, if it's specifically for one frequency of sound that maybe you're not hearing the best. This way we can judge that. Okay, perfect, and just on this side. Very good, excellent. And just last time on this other side here. Excellent, excellent. So you had no problem hearing those whatsoever, even in the beginning, or maybe a little in the middle, where maybe the sound kind of trailed off at all? No? Okay, good. Then that bodes well for your hearing, and it looks like that is perfect. All right, absolutely. It means we can move on right to the next one now, which I think we are going to do a little bit of a taste test. Okay, so we're just going to give this bottle just a quick shake here. Alrighty. So we will be doing, usually we do 5, but today we will just do 3, just to make it quicker for you, okay? 3 different taste tests, and I would just like you to tell me the pleasant taste that you taste from each spray, okay? Okay. And if you'll just stick out your tongue for me. Okay, let me just make sure it's working. Perfect. Here we go. And can you tell me what that tasted like? It's correct. Oranges. You are correct. Okay. We will move on to the next one. Okay, and we'll try. Let's do this one. Let's give you a bit of a challenge because we're only doing the 3. Okay. This next one. Let's give this one another test. Let's just test it first, just to make sure it's spraying properly. And just stick out your tongue here. And all right. And can you tell me what that tastes like? Yes, you are right. Strawberries. That is correct. That one is more of a subtle taste, which is why I thought it would be a little bit more challenging, but clearly your taste buds are doing superbly. So let's move on to the very last one, okay? It'll be the toughest one. Okay, let's see, which one should we do? From the toughest category here, let's do this one. This one is going to stump you, okay? This one's going to stump you. Let's just give it a spritz to make sure it's working. Excellent. Okay, and if you will just stick out your tongue, this is the last one here. Perfect. Very good. Now, if you can tell me what that tastes like. Yes, you got it right. Mango caterpillar. Good job. I did not think you were going to get that one. Huh. Well, it's this flavor that I saw on the show, so it's kind of a take on that. I can't believe you got it. Your taste buds are impeccable. Okay, let's move on then to the next one, because we clearly don't need to do any more tests for your taste. Okay, so let's move on to let's check out those eyes, okay? So I'm going to be using this little light here, okay? And I just want you to stay focused on it, okay? Good, okay, that's not a problem? Good. So if that's the case, we are going to just move on to the next one, because I know you are in a bit of a hurry. We're going to do the peripheral check. I'm going to be bringing the light in, and I just want you to let me know when it comes into your peripheral vision, okay? Okay, very good. And good. Very good. Good. Okay, excellent. Good. Excellent. Very good, very good. Perfect. Okay. Okay, excellent. Okay. Okay, good, yes. Very good. Okay, so everything's looking good with your peripheral. I do want to take that to the next step, though, and I'm going to be doing one more test to judge your peripheral vision, just to make sure everything is working properly, okay? So it's going to be basically the same thing, except on either one side, the light or my finger will appear. And I just want you to tell me which side it appears on, okay? The light, yes. Which side the light appears on. Okay? Okay, are you ready? Here we go. Correct. 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 Yes, good job. Yeah. Okay. Very good. Very good. Okay, good. Yes. Can always do those sides as well, too. Very good. Excellent. Okay, very good. Okay, just as I thought, everything's looking great with that peripheral. I just wanted to make sure, because with the last test we were able to move on to the next one based on certain key factors that I see within the nerve, okay? So we were able to rule out a lot, and it looks like everything is perfect with your peripheral as well as your eyes, okay? Fantastic. And I think we'll just move on to the next one. Okay. And I just wanted to check in. Everything's good with you? You're feeling okay with these tests and the results? Okay, perfect. Very good. So I think what we are going to move on to now is the touch nerves, okay? So what I'm going to be doing is I'm going to be taking this paintbrush, this clean paintbrush, as well as this chart pointer, and I'm going to be gently either tapping or stroking, and I just want you to tell me when or which instrument I'm using, okay? Kind of like a sharp or dull kind of thing, except we're not using something sharp. Okay, very good. So this one, I'm going to want you just to gently close your eyes, okay? And just wait for the sensations. And just tell me which one it is, okay? Very good. And just close your eyes. And let me know which one I am doing here. Which one I'm doing here, okay? Which one I am doing here. Which one am I doing here? Yes, you are correct. That is the soft one. And what about this one here? This one right here. This one right here. This one right here. Yes, you are correct. That is the tapping of the pointer. Now, what about this one right here? Yes, those are the brush strokes. And what about this one right here again? Very good. Everything seems to be good. Now, can you also tell me where I am tapping on your face? That is right, the forehead. Very good. Okay, and then we're going to do more brush strokes. Oh, I'm not supposed to tell you that. I'm going to switch this up here and tell me where I am tapping or stroking, okay? That is correct. And what about now? Actually, yes, I think that's where I was going with. Let's focus more on where you feel the brush and where you feel the tapping on your face with your eyes closed, okay? And reshut your eyes. Perfect. And where is the tapping happening? That is correct. And what about now? Okay, very good, very good. And where is the brushing happening right now? Very good, right there, perfect. And what about the tapping right here? Very good, very good. And what about right here? Very good. And what about right here? Yes, excellent. Okay, and what about right here? Very good. And what about right here? Very good, very good. And what about right here? Very good, very good. And one right here. Very good, very good. And last time. Very good. Yes, correct. Okay, you may open your eyes now. Everything seemed to be perfect with that one right there. You seem to hear it. You seem to be able to react, along with knowing exactly where I was touching and tapping and brushing on your face. And you did perfectly with that, as well as the being able to tell me if it was a poke or a brush. Very good. Okay. We are going to do one more in this nerve category, okay? The resistance test. I'd just like you to stop me from being able to move your head. I'm going to try and turn it to the left, to the right, up and down, and I would just like you to prevent me with the resistance in your head, okay? Very good. Okay. So we're going to start just going up here. Okay, perfect. Very good. Resist, resist, resist. Good, good. Okay, and then we're going to try going just down. That's right, perfect. Just resist. Okay, good resistance. And then we're going to try going to one other side here. Okay, very good, very good. And we're going to just do it on the other side as well, okay? Okay, very good. Prevent, okay. Excellent. Now I just like you to smile, and I'm going to try and pull down the smile, okay, to prevent you from smiling. Okay, here we go. Okay, very good. Very good, you prevented that. Now I want you to close your eyes, and I'm going to try and pull your eyelids to try and open them, okay? And I want you to prevent them from opening, okay? Okay, perfect. Okay, here we go. And we're going to try and move this here, okay? No, don't prevent me. Prevent me. Okay. Very good, just as I thought. Everything within the touch nerves and sensations you're able to pick up on, as well as being able to resist the movements. That is impeccable, absolutely. Okay, well, we will move on to the very last part of the cranial nerve exam, okay? Let's get started. Okay, so with the smell test, we are going to do similar to the last one. We are only going to do 3, okay? Just to make sure we can get you out here in a proper time for you, okay? So we have 3 vials. Well, I'm going to choose 3 vials. We have a bunch of different scents and flavors that we get to choose from, just to kind of keep you on your toes. Okay, so we are going to first get you to smell this one as we give it a really good stir here. Okay, very good. Okay, that should be perfect. So we want to make sure we get enough in the vial here, okay? So it's a stronger scent. So you definitely will be able to smell it just as I pass the drops back to the bottle, okay? You'll be able to get that aroma, and I'll do a few drops so there's enough scent for you to smell in, okay? And then just guess which scent it is. Perfect. Here we go. Well, let's get started with the first one. Okay, here we go. And begin inhaling. Okay, very good. Good, okay. And now tell me what smell you just smelled. Yes, fresh linens. You are correct. Very good. Let's choose a little bit more challenging of one. Okay. Give it a good stir. Okay. Perfect. Here we go. We've got enough here. Are you ready? Let's get you guessing the next scent, and here we go. Take a big inhale in. Very good, very good. And can you tell me what that scent is? That is right. It is pepper. The smell of pepper, the spice. Okay. Now I'm going to try the most challenging for the last one here. Okay, we're going to grab this one. Give it a good stir. Should it be this one? Yes, we'll do this one here. Make sure we've got enough. There we go. All right. And for the very last scent here we go. Inhale. All right. And can you tell me what that last scent is? It's a bit of a tricky one, so if you want, you can give it a second, just to give it some thought. That is correct. Yes, you got it. Yes, the scent of Gain laundry detergent. You got it correct. Now this one has been diluted quite a bit, so I'm surprised you were able to pick up the slight scent that's in there. Very well. Very well done. So, as it turns out, all your nerves seem to be in perfect working order. Everything is wonderful. You can smell things no problem. You can taste them no problem. You can hear them. You can feel them. And you can also see them no problem. Everything is working perfectly within your nervous system, okay? So yeah, that wraps everything up. And you were able to get out here a little earlier than I even expected. Perfect. Well, I hope you have a wonderful day, and I hope you have a relaxing evening as well. All right, take care.